Hi everyone, welcome to my channel. So today we have a very interesting one because we have this important personality in our midst. If you have been following the healthcare assistant journey and the trend and everything on YouTube, you must have seen Ugomma. So she is here today to share her journey with us, and I believe this is going to be an interesting one. And I believe all these other questions that you have about healthcare assistant, what they actually do in the UK, is it possible to get these jobs? This is a living example of someone who is a healthcare assistant and she's having her best time in the UK. So let's listen to her. So welcome.
Thank you.
I'm really excited to do this video with you today. Okay. So she's going to share her journey with us now. So Ugomma, what do you have for us? Can you introduce yourself?
And yes, of course, you've introduced me already. So my name is Ugomma, you guys. Ugomma, okay? So I recently moved to the UK and via Tier 4 dependent visa, and I'm currently working as a healthcare assistant here in the UK and in NHS, okay? So I'm gonna share with you guys, how the process and my journey on how I got to the place where I am now, okay? So yeah, that is just it.
So yeah, so I actually follow Ugomma on YouTube. So if you guys have not seen her before, just check her out because she shares a lot of gems on her YouTube. Like she shares information about studies, she shares information about her life as a healthcare assistant. So if you're interested in working as a healthcare assistant in the UK with this new visa sponsorship that is out there, then you want to watch her videos. So she's having her best time, and that's why I said, okay, let's do a collab video and see actually if you guys will come here and also ask her your questions. You can drop your questions on the comment section. She's going to share her journey from the beginning to the end. So just make sure you watch this video till the very end. Okay, Ugomma, we are all here.
All right, so you guys, my journey of working as a healthcare assistant. Okay, it started from in Nigeria. Like if you go to my channel, you see we have posted a video. Like we've been here quite for 5 months now. So before we left Nigeria, I already know that this is what I wanted to do, like healthcare assistant. This is what I wanted to do. Okay, so what I did, because I didn't do science, neither did I have any health experience. She get so. I started doing research, how to improve myself and all of that. So I took one course in the University of Toronto. It's actually a free online course, okay? So when I had the course, I did it because I wanted to have a closure of what healthcare assistants or LPN, depending on the country you are, what is like, okay? So that's why I started that course, all right? So in the process of the course, I actually realized, yes, this is what I want to do. I'm enjoying it, okay? So that is when I started, yeah, this is it. This is it for me. Even if I travel abroad at the end of the day, this is what I'm going to do, all right? So when we now moved here, actually, we got here around September, and immediately we got here, I started applying. We were still on isolation, and I started applying for jobs. So I got my NHS offer, I think 1 month after we got in the UK. Yeah, it was that fast. Yes, it was that fast because I already done my research. I already know what I wanted, you get? And NHS is what I wanted to do as well. So when I applied for NHS, NHS recruitment process takes a lot of time, all right? And a lot of requirements, and the application is not here, now. So that was just it. I applied, the one I applied for, it didn't require any experience at all, okay? So because you'll be trained on the job. So when I applied, even during the application process, I was asked if I have any relevant digits. So of course, I already did one program. Sorry. So I uploaded my CV. Of course, it's already in my CV. And you guys, if you're applying for a healthcare assistant opening or a job opening for healthcare assistants, please, it's important, if you have any voluntary clinical experience, whether it's paid or unpaid or professional or not, please include it in your CV, okay? It will help you, honestly. It will help you because some persons, because it's not paid, maybe something they did out of voluntary and all of that, they wouldn't want to include it. So please include it. It helped me a lot. Though mine wasn't a professional experience, okay? It was more of a personal because, it was taking care of my grandmother, All right. So I included all that in my CV with my certification from University of Toronto and applied for the job. Honestly, really, I didn't expect I would get a job. You know why? Because this was just like few hours and a few weeks after I got to the UK. Okay. So when I applied and after like some time, they sent me an email telling me I've been invited for an interview. I was like, what? It was unexpected. Do you get? So I believe what helped me was the personal experience I had and the certification as well. Do you get? Because even though some of these openings, they will tell you, don't, even with that experience, you can apply. It's important you put experience, whether paid or not. Do you get? If you have any certification, fine and good, include it as well. So after the interview, and that was how I started working as a head CS.
Exactly. Like this is really, this is really insightful, and thank you for that, because some people will be thinking, oh, because I don't have a healthcare background, or it's not possible to apply for these jobs. So it's what I actually picked from what she said is that she actually got ready, and because of those courses that she took on, like, she got ready, and immediately she got to the UK, she applied for these jobs, and she included everything that she knows. Just be honest and just include any opportunity. Like I usually share that you can just attach yourself in a particular hospital around you, and then you can include that in your CV, saying, oh, I worked here so time.
That's what they want to hear.
Yeah, exactly. When I was working in Nigeria, like I have someone that was working with us as a healthcare assistant. I didn't even know what that term was, but I was told, oh, she said she just helps us around because maybe she has this kind of thing in mind and we didn't know about.
Yes.
So that is something that you can do. Just any hospital around you, ask them to allow you to work with them, and you can.
Of course, they will. They will. Yeah.
So thank you for that, Ugomma. Can you, since you started working as a healthcare assistant, have you faced any challenges? Do you like the job, and like what is it like?
Okay. Basically, I'm enjoying the job, honestly. And that brings me to what I even forgot to mention this. Okay, before you apply for this job, you make sure that this is what you want, all right? So that, when you are doing a job you enjoy, there is this tendency that you will do so well in the job. Do you get? So if you're applying for HCA, make sure you are applying because you want to do it, not just because you want to come to the UK. And you understand? Because if you're applying it because you want to come to the UK, then you may be frustrated because it's not that easy. I must mention this, okay? It's not that easy. So am I enjoying the job? Yes, I am enjoying the job. I love it working as a head CA, okay? Maybe I didn't mention, I actually work as a carer in a care home as well, all right? Because my job is kind of flexible, all right? So yes, what are the challenges? The basic challenges is not quite, okay, taking care of a lot of patients is a lot, okay? But the major challenge we face is, when somebody dies, and a family calls, like trying to speak with the person, and they have not had the information, and trying to break it down, like this is what has happened. And okay, I had an experience in a care home that I worked in. Actually, this man, he died. The senior carers, because I was asked to go and do an hourly check. So when I got to his room, and the man has already passed, it was shocking. That was my first experience. It was like I didn't know what to do, because when I got close to him, he wasn't breathing. And he has turned pale. So immediately I ran out. I called my manager. This is what is happening, and she was like, "No, he's fine. He's fine." I said, "No, he's not breathing." That was when she now. Oh, so that is one of the challenges. Watching someone take their last breath, like. It's something not everybody can handle that. Okay, that's one of the challenges. Another challenge we face, you guys, a lot of these patients, these clients or customer, whatever, a lot of them are racists. Okay, sometimes you'll be taking care of them, like giving them PC, personal care, and they'll be like, "I don't like you. I don't like you. You black. Using the F word on you." Oh God, it's so annoying and demoralizing. Do you get? So those are one of the challenges that we face, but generally, the job is, you get, for me, it's fulfilling that I help people live their best life. Take care of people.
I totally agree. Like recently, I got interviewed by some people asking me whether I've actually encountered any racist comments since I started working in the UK. But the truth is that if you're always taking that to heart, like if you're always expecting these people not to like you, even when they are just behaving as, client, people that work, people that are sick are in a hospital, usually they have this kind of stress factor. So
exactly,
they can easily get irritated and all of that. And when they behave certain way, you might feel offended. I know some of them usually use some of these words that are really not good. But the thing is that some of them are actually doing that because they are sick, they are stressed up, they don't want to be in that environment. But some of them are still people that don't really like you because of who you are.
Skin color.
For me, I actually say that they are like just like a 1% or 2% when you know that this person doesn't like you. But some others, they behave in a certain way. Like why I say that is that sometimes you'll be thinking it's because of you, but you see them behave the same way with even people of their own. So you know it's because of that environment. But you still see this kind of comments, right? So it's part of it. Even in Nigeria, there are people that don't like you because of your religion or where you are. So it's like something about the job actually. So thank you so much, Ugomma. Like I really appreciate you, because people will now know that this is still a job. Like it is something that can give you, it is something that gives you the opportunity to be in another country, experience
exactly
and all of that.
And it doesn't just end as a it doesn't just end as a HCA or a carer. Working in this my type of job, you still have the opportunity to like progress in your career. Do you get?
Exactly. Thank you for that.
Yeah. You can still go
have
ahead,
opportunity to progress. Like some hospitals, like my hospital, they have something they call apprenticeship program. They have another one that they call associate program,
they have it
and they sponsor you. So when you eventually finish, you still get employed by them. You just work with them like for my one, they said 6 months, and after that 6 months, you can work any other place you are. So it's really quite interesting, and you don't have to worry to pay and all of that, because they will do that. So thank you so much. So at the end of the day, would you say that this is actually a good opportunity with all this visa sponsorship and everything that is going on? Would you say that this is actually a good opportunity? And will you encourage your own people to be healthcare assistants?
Honestly, yes. One of my aunts is actually interested in this, okay? I will encourage people to apply, but why applying? Make sure you are qualified, okay? A lot of people, they don't care. Immediately they hear HCA opening, they just apply. Do you get? Go through the job description, make sure that you have the relevant experience and qualifications needed, okay? However, some of these HCAs, you may not require experience, especially those in the care home settings, okay? But I know that in the NHS, some openings, may not require experience. However, please get certified. There are lots of free courses that you can actually take, okay? And get certified, get the relevant experience. See, the hustle is real now, okay? The competition is fierce. Okay? So they are looking for, whether agency or care homes or NHS, they're looking for the best candidates, okay? So trust me, you can get this job from Nigeria. Actually, somebody I know, she didn't want me to share her story, but she has gotten this job. She's from Ghana, and she got it from Ghana, okay? And she'll be coming in a few months' time. Do you get? So people are getting it. So I encourage you all to apply, okay?
Okay. So thank you so much, Ugomma. And I hope you are inspired, and you are inspired by this video. Check out her video. She has a lot of videos and a lot of things that will inspire you if you really want to be a healthcare assistant in the UK. So one thing I would say you have to take out from what she said is, get certified, get yourself ready, because this is something that is popular, and a lot of people are using this opportunity to come to the UK. And even with this visa sponsorship and everything that a lot of care homes and agencies are offering, people are using this opportunity. So don't think you are the only person. And if I am the one recruiting, I will go for the best.
Exactly.
So just increase your chances, guys. Increase your chances and apply. Don't be scared to apply. See, she did not even expect it when she got to the UK, but she was actually called, because if she will agree with me, even though a lot of people are applying, every day that I go to work, we are still short of staff.
Both healthcare and
nothing. People are resigning, people are joining, and a lot of people are joining from the Philippines, from Nigeria, from India. But yet, when we get to work, we are still short. So don't be scared. Even though there is competition, be part of the competition. And I wish you the very best, and I hope you enjoy this video. And always come back, subscribe to my channel, subscribe to her channel, and I believe you get all the information, all the motivation, and everything that you need to get this job. And we wish you the very best. See you.
Yes.
And